Good morning, everyone. Welcome to our Healthy Start Workgroup meeting. I'm actually going to go ahead and turn it over to Dr. Cooper for our official welcome.
Good morning, everyone, and welcome to our April meeting. We have some exciting things going on. If you have not done so, please type your name and organization in the chat. And please note this meeting will be recorded. So just if you don't want your camera on, please don't put your camera on, or if you just want to place things in the chat, please do so. Okay, and now we're going to cover or actually pivot into the agenda today. We're going to move forward with, of course, the welcome and the review of the agenda. And so now we're going to focus on regrounding. So we're going to take a peek at our problem statement, do a deeper dive in the evidence and our strategic focus, and then look at the next steps as far as action planning and the evaluation process as well. And then we're going to pivot into our community announcements and look at upcoming meetings and adjourn. And with that, I'm going to actually turn it over to Shanae and AJ.
All right. Thank you, Dr. Cooper, for that warm welcome. And thank you again, everyone, for being with us today. So today, as Dr. Cooper mentioned, our focus is on this final phase of the CHIP, which is our strategy development. So our goal today is to take everything we've learned from the problem statement, the data, all of our discussions, and translate that into some actionable strategies that we can implement together. But before we dive into that, I do always think it's important to just briefly review all that we've established that brings us to this point so far. And again, this really just ensures that we all have a shared understanding, especially for those who may be new with us today. So we welcome all of the wonderful new faces. Or for anyone who may have missed a previous planning meeting, it just helps to make sure we're all on the same page. So just to quickly review, the problem statement that was selected by our CHIP steering committee highlights that many pregnant people lack consistent prenatal and postpartum care, especially for those with Medicaid or without insurance. And as we grounded ourselves in the data, the 2025 Community Health Assessment, or the CHA, highlighted some really important challenges here in Prince George's County. And what we saw were that there were higher rates of late or no prenatal care compared to the rest of the state. Alongside that, maternal mortality rates are also higher than the Maryland average, and we continue to see elevated rates of low birth weight as well. And so we ask, why does this matter? And you all are well aware that these aren't just statistics, right? They represent real gaps in access, in support, in that timely care piece. And we know that when prenatal care is delayed or missed, it increases the risk of preventable complications for both the birthing parents and the babies. And importantly, these challenges also disproportionately impact communities that are already facing systemic barriers, right? We see that across the spectrum when it comes to our social determinants of health. And this really just underscores the importance of our work, the importance of all that you all do for our community, and ensuring that everyone has that equitable access to early care, to high quality care, and especially that culturally responsive care. So we had some root cause analysis discussions back in January and somewhere in the fall with other work groups, and we identified several starting points to address the issue, right? So instead of trying to address all of it at once, we instead wanted to focus on identifying one strong starting point. And so we polled the group, and you all voted to focus on that system navigation and care coordination piece, specifically how we can improve the way that our families find and access and move through those maternal and infant health services. And from there, we discussed what success could look like over the next 3 years and identified some common themes around community input, around communication, taking some traditional versus non-traditional approaches, the education piece, and definitely highlighting culturally and linguistically appropriate care. And so these themes really helped guide the development of our drafted goals, which you all took the time to vote and prioritize this past month through that survey. So thank you all to those who responded to that for their feedback, for your feedback. So thank you again. All right, so with that, we looked at the responses for the survey, and you all selected goal number 1, okay? And so goal 1 reads that we want to improve equitable access to timely and continuous prenatal and postpartum care. And this goal really just focuses on ensuring that all of our residents have that equitable access to care, with an emphasis on trying to reduce those disparities, improving early engagement in care, and supporting healthy outcomes postpartum, for both birthing parents and infants in the county. And so based on some of the work group discussions that we had, that survey feedback, we had like that open-ended discussion for those to provide feedback, we drafted 2 smartish objectives aimed at addressing these goals. And so these objectives really are focusing on increasing early entry into prenatal care, as well as strengthening that continuity care in that postpartum phase. And we wanted to emphasize, culturally responsive outreach. We wanted to emphasize community-based supports, and then increase navigation of those trusted services, particularly among high-need populations and communities. So now we get into the fun piece. And I just want to first, just say thank you, thank you, thank you, because your ideas and all of this discussions that we've had have been incredibly valuable throughout this entire process. I know we've covered a lot of ground together in such a short amount of time. Remember, this first meeting was just in February, and some of our other work groups have been meeting for years. So I just want to thank you all for coming together so quickly and just being so effective in our planning and our conversations. And now that we've landed on a focus goal and some objectives, we get to move into the fun part, which is the action planning. And so what we're going to do now is walk through an action plan template together and start to really organize these ideas into something a bit more concrete. And based on everything that you've shared in previous discussions, we've already started to pull together a set of drafted action steps. And what they are is they're meant to be, coalition level, they're meant to be practical, they're meant to be measurable, and we'll walk through those today. But we need your feedback, right? Because this isn't the health department's plan. This is a coalition. And so it really does take the community's voice. It really does take partner voice to make sure that what we're doing will have an impact and will be effective, and that we all have the capacity to contribute together. So, as we present some of these drafted action steps, I want you to consider things, like, does this feel feasible? Is this realistic in the settings that you're in right now as FQHCs, as providers, as community members, as partners? Are we even measuring the right things, right? And maybe there's some gaps in who we're serving. Are we missing populations? Maybe there's people who aren't at the table with us today that we need to extend an invitation out to, right? And be a little bit more intentional about that. So we're open to all the feedback, and we would appreciate all the feedback, but this is really the stage where all of our collaborative ideas really start to turn into those real strategies that we can actually implement. So your feedback is super important. So what I'm going to do is I'm going to go ahead and pull up the action plan template. Oh, thank you, AJ. Awesome. All right. Great. Okay, so what you'll see again are some draft action steps that are aligned with the goal and both objectives. And again, these were intentionally written from a coalition perspective. So it's not what one agency can do alone. Sorry, I'm tripping over my words there. But it's what we can all do together to move forward together. But it's all based on the feedback that we've had in our previous discussions. But one thing that I thought was really cool, one thing that stood out in you all selecting this particular goal and these particular objectives is that the strategies that can be implemented are actually cross-cutting. So in other words, I think these action steps can really support both the prenatal and postpartum care through that outreach, through the community-based support, through the equitable access to culturally relevant information. So why don't we go ahead and take a look, and we will start with our first objective, which centers around that prenatal care. And so based on your input and some additional background research, these are the action steps that we found strongly aligned with improving that first trimester prenatal care, especially when we implement all of these action steps together in a more coordinated approach. So the first set of strategies focuses on strengthening partnerships and referral networks, right? So we know that early prenatal care often comes down to how quickly someone gets connected after they discover they're pregnant. So the idea here is to try to build a more coordinated entry system, to engage trusted access points like WIC, like the community-based organizations that are represented here, and others, and to try to make referral pathways clearer and faster. There was also some discussion about potentially mapping services and potentially creating like a shared referral or resource directory. And I don't know if Jennifer's on the call, but she had mentioned something similar to concierge care. We talked about findhelp.org. And Annie, I think you mentioned mdmom.org, I think it was. So just wanted to present these first set of action steps to you all and to kind of gather some initial feedback. Okay, yes, thank you, Annie. I thought that was you. So yeah, so what are your thoughts on some of these initial steps? And you are welcome to unmute. You can write in the chat. We welcome all feedback. Does this feel doable? Are we missing anything?
I think this is
I,
the right steps.
Thank you, Dr. Cooper.
I'm curious if the strength in community partners and referral networks, if there is thought or discussion around their partnership with each other. So I'm thinking CHWs to providers often aren't working directly under a provider care team, same as doulas. So might want to facilitated or a method for care coordination or communication between them.
Yeah, I think that's great. So when you say like facilitate that method or that communication, do you think that would start with maybe I don't know, I haven't put too much thought into this yet, but the first thing that kind of came to mind was hosting like a forum or a listening session of sorts where CHWs or doulas can come together with providers and we can kind of facilitate that conversation of what that could look like. You know, how can we get CHWs connected to those providers or the doulas directly connected with the providers so we can have that warm handoff or that direct connection to services, whether that's prenatal or postpartum. Is that kind of what you're referring to, or did you have something else in mind?
Yeah, I think that would be a good first step. And then also to learn what the networks currently look like, who's working under what model, what CHWs or doulas are working as sole providers, who are working under networks currently, like what kind of mapping that I think would be helpful too.
Okay, great. Thank you for that feedback.
And just to add to that, again, I totally agree with that. Um, do we have a network of doulas here in Prince George's County? I know they have a network in Baltimore City. So if we have a local and I can reach out to find out, then bringing them, as was stated earlier, to the table and helping them to, integrate into the system and getting providers and the whole network familiarized with those resources that can bridge those gaps.
That. Okay, great. Thank you, Dr. Cooper. Dr. Apgar, I see your comment. I think technology will be extremely helpful in pushing this forward or using existing platforms. Any progress is helpful in creating more nodes in the safety net. I agree. Great comment. Thank you for that. I'm noting that. Okay. Okay. So I've taken those notes on that feedback. And again, so just a reminder, this is a 3-year plan. So we don't have to do everything at once. If in
Sorry,
year,
I had a quick comment.
oh, sure.
I had my hand raised, but
I'm
I just
sorry.
had a quick comment about utilizing the existing resources that we have. I don't know how this will be connected to like platforms like Find Help. I know a lot of people use those type of platforms that we were not, reinventing the wheel, but we are connecting to what's like our already existing.
Love it.
And Shanae, actually, I also had my hand up. So no worries.
I'm sorry,
but,
I can't see the hand notifications. I apologize. If
No,
AJ or Dr.
that's
Cooper can help me facilitate that, that would be great. I'm sorry.
No, that's cool. I just wanted to mention that, there are several of you on the call actually who attend the perinatal risk assessment working group that I facilitate as part of the Maryland Department of Health's Integrated Maternal Health Services project. So hi, everyone, for those of you who know me, and some of you actually also work with some of the providers that we support. This is actually something that we're working on. So so one of the things that we are developing right now are regional coordination teams. And there is one for Prince George's County. It's still a little bit informal. We are basically looking for champions, in the region to kind of facilitate perinatal care coordination. And, this idea is sort of in its infancy, but, I did want to mention it. We're doing a decent job, I think, at this point of bringing the providers that are working with us together, and we are looking to expand. So actually, Tammy, if I can connect with you offline about maybe having Luminous join, that would be awesome. But the step that we haven't taken yet, and part of this is just because of the timeline of the project, is doing that next step to then bring in, doulas and like independently working doulas and CHWs and CBOs. But that is in the plan. I can keep folks updated about where we are, either in the prog or also as part of this work group. Primary Care Coalition is really only handling one piece of this project, but there is kind of a broader IMHS sort of directive to essentially enhance perinatal care coordination in Maryland, which is what we're talking about here. And Prince George's County was one of the first jurisdictions that this project is piloted. Excuse me, Shanae. I think I'm also catching the words thing.
We need lunch or something.
I don't want to monopolize the meeting, but I do want to say, some of this work is happening, and maybe we're not at the point where we're doing that great of a job of communicating it, and that's also a future step. So, just so folks know.
No, I think that's great, and I think that's something that if we can connect offline to kind of dig a little bit deeper into that and see how we can work together in that, but maybe have IMHS come and present again to the coalition, specifically Healthy Start, because that work group didn't exist when you all presented last year. So I think
I would love that.
Yeah. Okay.
Yep. Just send me an email. That'd be great.
Awesome. Okay, great. I love that. Am I missing any other hands? Okay, great. All right, let's go ahead and move on to our next set of action steps, which centers around culturally responsive outreach and education. So we know that delays in prenatal care are often driven by things like not knowing when to start care, not knowing where to go. There might have been mistrust or like prior negative experiences. There's barriers around language and culture. So the goal here is to try to normalize that early care and make access clear, especially regardless of insurance status. So some of the strategies we outlined here include partnering with those trusted community organizations and messengers to share information about when and how to access care, whether that's in a variety of languages. We want to make sure we're highlighting or considering plain language, simple language, as well as utilizing those different formats like print and digital media. And Dr. Apker, I remember last meeting, we talked a bit about that social media component or using technology to kind of help push messaging forward a bit more. But messaging like this is important to consider, particularly emphasizing how to access care for those with Medicaid or no insurance. We also want to consider, we know that, again, not reinventing the wheel. There are a host of community education sessions and events that are already happening in Prince George's County. So helping to promote that, but also seeing where there may be gaps in those educations and potentially trying to, come together to maybe host a community education session that addresses the same, around that importance of care and how to access it. And so partnering with organizations and being more intentional, about reaching specific populations like the immigrant communities, like the non-English speaking populations, or those who are uninsured, meeting people where they are and utilizing those trusted messengers to help share important education and get people connected to care. And then finally, we want to make sure that we as a coalition are showing up again at those existing events. I'm getting emails about community baby showers, there's health fairs, it's Black Maternal Health Week, so there's a variety of activities going on there at the government level, at the community level. And so, we don't just want to go to these things and just to share information, but maybe go and actually be the warm handoff, actually help connect people to care in real time, which I think is a piece that's often missing when we go to certain health fairs. So just wanted to present those action steps. Again, just, any feedback that you have on this approach, great idea, not so good, partners that we should be considering, other strategies we should be considering. We're opening the floor.
Looks like we have one hand up. Rodrigo?
This is Rodrigo from La Clínica del Pueblo, and we've been doing also an internal perinatal needs assessment and collecting a series of methodologies and community focus groups. And the issue that keeps coming up is the perception of isolated motherhood, and particularly for low-income immigrant communities. I think the fragmentation and the types of work that they're involved in, right? Food preparation, cleaning, all this like causes really fragmented social networks. And the thing that keeps coming up is that notion of, I don't want to be alone in this. I'm alone, but I don't want to be alone. So just going back to your initial question of what sectors or who should we be tapping into, I think, I don't know if it would be possible to identify any unions representing these sectors, either food preparation, either cleaning work, or even caregiving roles, for example, in daycares. All these centers have to be involved, because at least coming from the population that receives services at La Clínica del Pueblo, that's where the majority are working. And it's the type of labor exactly that prohibits them most of the time from really establishing robust social networks, or at least that's what they've been.
I love that.
So I think trying to involve those sectors where they're working in would be important.
I love that. Thank you for that feedback. And that's a great population to consider. And you said you've already done focus groups to kind of get that feedback?
Yeah, and I'm trying to like synthesize. But yes, we've done a couple of focus groups, both in Maryland and DC, and that is the theme that is recurring, the perception of isolated motherhood. So I really, the first ideas that were being thrown out there about an expanding a doula network, I think that would be quite important. would just be the coordination of how to access it and be referring, and can community groups be developed. That would be very important.
Yeah, I love that. Love that. Thank you so much. I'm taking that note down. Yeah, I remember that there was some conversation around having support groups for various peer-led support groups for various populations and communities that often face additional barriers to seeking care. So, Rodrigo, I'd love to connect with you offline as well to kind of learn a bit more about those focus groups and what came out of that, if that would be okay.
Yes, happy to do so.
Okay, great. Any other feedback?
This is Rodrigo again. Just for the first point as well, we have developed, and it's about to be live, sort of a version of the Find Help. It's sort of duplicating the wheel, but it's been really vetted by the organization La Clínica for those trusted partners that the immigrant community utilizes.
Okay.
So it's a repository, an additional repository of information, which is completely in Spanish, that may be very helpful to the community. And it's mapped some PG resources.
Love that.
And if we can integrate maternal additional resources, I'd be happy to integrate it in the platform.
I love that. That's great. Thank you. And if that's something we can help promote, we do have like a community resources tab on the PGC Help Zone page. So if that's something that, and again, we can talk a bit offline, but if you all ever have resources that, we can help promote or share on the website, we're happy to do so. Any other feedback? Thank you, Joanna. All right, hearing none, we'll go ahead and move on to the next set of action steps. And the next set of action steps centers around care navigation. And so, we know that even when someone wants care, delays can happen, whether that's because of insurance, scheduling, again, not knowing where to go. And so this is where really that navigation support can make a true difference. And so some of the things that came out of our discussion was, expanding or supporting those CHWs, the doulas, those patient navigators, case managers, especially for that Medicaid or uninsured population. And then, of course, we're having our conversation today about other populations to be considered. So that's totally fine to consider them as well. Other action steps are proactively connecting people to care early in pregnancy through that outreach and community-based identification piece, and then making sure that people are linked to comprehensive services. So it's not just about that single visit, right? So it's not just about that prenatal care, but we know that they might also need services from WIC. They might need mental health or behavioral health support, that doula support. Doulas aren't just there for the birth, right? There's postpartum doula support that's available, prenatal doula support, and other social services that are available, transportation services, food services. So it's exactly, Dr. Cooper, that continuity and coordination of services is really important. So I'd love your thoughts here. If there's anything that's working well already, are there any gaps that we aren't thinking about, that we haven't considered, or maybe needs a little bit more of our efforts on? Interested in your thoughts here. Dr. Cooper, I think this would be a good space. I know you were talking about kind of looking into that CHW network in Prince George's County, but I think this would kind of all correlate with that as well, align with that.
This is Rodrigo again. I think one key thing that keeps coming up is the co-located services. So like people don't have to go to multiple places if they can, at most, I don't know if that's possible in the PG network, but like I know FQHCs, and biased because I work with one, but like that model is quite important as like reduce the number of places and locations we have to go to. So at most, if the co-location of health and social services can be integrated under one roof, it's quite
Absolutely.
beneficial.
Love that. Thank you for that comment. So another comment that came out of another work group was utilizing additional community spaces or third spaces. So thinking about, we have our FQHCs, we have the health department, we have our hospitals, but looping in places like the library system, like our school systems, right? We know that people often frequent the library. They often they trust information that's shared at the library. We know that our families are going to the schools because they have other children. So finding other creative spaces or creative ways to share information. Maybe it's going to the library on a Saturday and setting up a table to share, resources from the FQHCs that you all are working with, or, I mean, we can find a variety of ways to share additional information and to get people connected to care. But just wondering what your thoughts are on additional third spaces as well. Barbershops, hair salons, yes.
And they have been proven locations to not only disseminate the health messaging, but also partnering with healthcare providers. I know we've done that in Prince George's County under the School of Public Health, the Center for Health Equity, and working with Luminous, working with the University of Maryland Medical Systems, and having those providers to come in to do the pre-screening. And because those are trusted sites, they serve as conduits, excuse me, I'm over my words as well, in connecting individuals to healthcare. So I think we can't ignore the fact, meeting people where they are and the value those particular settings can offer.
Love that. Love that. Thank you, Dr. Cooper. And I see a couple other comments. Anya, she agrees with Rodrigo that transportation barriers regularly surface to impact access to care. Dr. Cooper, your comment about the barbershops and hair salons. Any word of mouth is so important. I agree. Dr. Apgar, it would seem, oops, where'd it go? Oh, it would seem that creating a network of existing pregnancy peers that could mentor others between or during visits. I love that idea. I think that's something we can definitely consider. Anya, WIC offices, yep. And Annie, having community members who have had good experience talk to their family and friends is critical. So again, that kind of peer learning, I love that. Yeah, transportation barriers include parking meters that tick loudly in our patients' ears while they await their visits. Tanika, social media is a great way to get the younger generations. Yes, because it's a population of young people that are also having babies. So I think that's important. And even talking about prevention and all those things. So this is great. This is great. I love all of your comments. Thank you. And I am noting those as well. Great. Awesome. Thank you all for that feedback. And I think we're on our last set of action steps, which centers around identifying and addressing barriers to care. So we know the big ones, right? Insurance gaps, transportation, work schedules, childcare. And we also know that these can look differently depending on the community or the population. So I think implementing barrier reduction strategies can directly target this. And that's kind of what we're alluding to here, even in our comment section in our conversation a little bit. And so again, I've noted your comments looking at traditional and non-traditional spaces. Dr. Ackar, how could those non-medical nodes like the salons be incentivized to be a hub for medical information in addition to volunteering? So yes, we can look at incentivizing those spaces. And Dr. Cooper, I know that that's something you've done in the past, so we can lean on you for guidance in that area and your expertise there. But I think that's a great idea. Okay, so one of the things that we discussed was trying to elevate the community voice. And so we talked about, I think Annie was the one who talked about how word of mouth is so important, right? So whether that's sharing resources, sharing your stories, and just getting that input from people. So I know a lot of us are probably surveyed out, but that is one method of gathering information. Our surveys, our focus groups, listening sessions, those community forums, right? Going out in the community and just meeting people in the spaces and where they are to understand how these barriers are affecting our communities and how they vary because, again, your geography, where you live, population, your community. There's so many other factors at play here. And so the idea would be to find creative ways to get that input and then synthesize that information to share with our community partners, to share with our providers, to hopefully help find some solutions in how we can inform service improvements. And then we would take that information and then find ways to work together to support those solutions, looking creatively into transportation assistance, childcare support, promoting flexible health services like the telehealth, mobile clinics, pop-up services. I could see, for instance, if we wanted to look into like connecting with the hair salons. Maybe there's a pop-up service at one of the hair salons in the neighborhood or a pop-up clinic at a library or, just spaces like that. It's getting warm outside. We could set up a table at a park somewhere. Mamas are bringing their babies to the playground. So just trying to find creative ways to, again, meet people where they are, to gather that community voice and to share important health information to get people connected to care. And I think this is also a space where our community health workers or those doulas or case managers, patient navigators can come out and assist with making that direct connection to services. So again, thoughts on this approach? Are there any specific barriers or solutions that you're seeing that we should maybe call out a bit more specifically in this area?
Just a quick comment.
Sure.
We have had, and our partners have also had a lot of trouble getting responses to surveys.
Mhm.
I'm sure everybody here who's tried to do that, people just don't know where their information is going, they just
Yeah.
don't want to take the time, or maybe they don't have access to the technology, whatever it is. So if anybody has tips and tricks for survey response that they'd like to share, I would take them because historically that has just not been a particularly effective way of gathering information for us for this group.
I agree. I think it leans into kind of the comment I made earlier. People are a bit surveyed out, but also I think just given the change in times, there's a lot of mistrust. And so I do think, as a whole, as providers, as people who provide services, it is important, to you all's point, like meet people where they are, walk through those surveys with them, having just conversation. I think you can gather so much more information just from having a conversation than you can a couple of questions on a piece of paper. And so that seems to be how I tend to gather the more feedback or to get a greater response, but interested if anyone else has any feedback in that.
Another barrier that, once again, citing the information that we've identified, is early identification or disclosure of any gender-based violence happening in the home, because I know that is directly tied with seeking care. So I think screening in health centers of any potential domestic violence, I think that is a big barrier that should also be addressed.
Love that. Thank you, Rodrigo. Any other thoughts? Okay. All right. Well, thank you all for this feedback. Again, these are just those drafted action steps for our prenatal care, very similar to our postnatal care. I think there's some cross-cutting themes here. And I do, again, just want to reiterate that this CHIP document, it is a living document, meaning that these action steps, they're meant to be iterative. They're meant to be shaped by you. So over time, we can react, we can challenge, we can add, we can remove, we can build on anything that's listed here. As new data comes out, if we need to shift focus, we can absolutely do that too. I think that's the beauty of having the flexibility of this CHIP document, is that we can change as the community. If the community is saying, hey, we're not headed in the right direction, we need to shift our focus on something else, we can do that. And I think that also helps to build that trust with our community. So thank you all so much for your feedback. Next month, what we'll do is we'll incorporate your feedback. We'll make some adjustments to the language, to the verbiage, and review that with you all, as well as that postnatal objective piece as well. And get your feedback on that. And then our hands are clean with the plan, and then we can go into implementation. So I'm really, really excited. Thank you all again so much for your participation in this. And what we'll do is we'll close out with community announcements, but I see a couple of comments. Rodrigo had to step out. Thank you, Rodrigo. Also engaging at pediatrician offices, care centers, women with other children. Yeah, love that. Thank you so much. Thank you for extending the invite. Thank you for your commitment. Awesome. Thank you all for your feedback. I'm going to go ahead and share my screen for community announcements. We have a few. It's a busy season. We have so many community announcements. And again, if you all have anything that you all want to share, please feel free to email those to me, and I can get that out to the coalition as well. But let me go ahead and share those community announcements. AJ, are you ready?
Yep.
All
So
right.
to aid your wellness journey, Capital Region Health will be providing free health screenings at 2 upcoming local health fairs, ongoing health promotion and disease prevention education classes. For more info, please visit the link that is on the slide, and we'll make sure that is available to you after the slide. Sorry, after the meeting. Come out and join County Executive Aisha and Brave Boy in celebrating 330 years of Prince George's County. Saturday, April 18th at 3:30 p.m. For a free community celebration with food, music, county resources, and information, games, and more at Northwest Stadium. Live performances by the Prince George Police Department. Their band, special performances from local talent, all emceed by comedian Joe Claire. Light bites will be provided on a first-come, first-served basis while supplies last. Sensory moment will take place 3 p.m. to 3:30. Fun for all ages. Don't miss it. Next up, we have a free rabies vaccine and microchips clinic. So that is going to be in the city of Bowie. We'll be hosting this weekend, April 18th. 10 a.m., 1 p.m., rain or shine while supplies last. Bowie City Hall. It says the rear parking lot near the pond. So it's going to be 15901 Fred Robinson Way, Bowie, MD. Services provided is going to be rabies vaccines, microchipping, and services will be performed by Dr. Allison Moko of Bowie Spay and Neuter. So we encourage you to share this information with residents, community partners, and through your networks. This is a great opportunity to support pet health and help families access essential services at no cost. Join Prince George's County Community Partners each month for 90 minutes of free virtual fun to get active and learn tips for making healthy choices. April's topic will be smart screening for colon health and will take place Wednesday, April 22nd from 6 to 7:30 p.m. The email to register is on the slide, and they will be hyperlinked as well. It also has been hyperlinked to the 2026 program schedule for your viewing and awareness. Prince George's Mental Health Champions are hosting a free ice skating event for all ages at Bowie Ice Skating Rink on Friday, May 1st from 6 to 8 p.m. You can email the email address on the slide or scan the QR code for more information. Join the GOAT or GOAT Expo team on Saturday, May 2nd at Bowie State University for a full day of workshops, resources, live performances, and support for youth 16 to 25 and their families. This event is free to attend and you can register via the link on the slide. This year's Older Americans Month theme is focusing on prevention, wellness, and personal responsibility as essential components of healthy aging. In support of that theme, we believe offering preventative health services during the fair would provide meaningful value to participating seniors and reinforce the importance of proactive health management. If feasible, we would be grateful for consideration of any available screening services, such as blood pressure checks, blood sugar glucose testing, cholesterol screening, vision and hearing checks, bone density or osteoporosis risk assessments, even fall risk assessments, right? So please contact Warren Wilson for more info, or if interested, email is going to be on the slide. Your Prince George's County Mental Health Champions will be hosting their Spring into Wellness Behavior Health Expo on Saturday, May 16th at the Southern Region Technology and Recreational Complex. Join them for a free interactive community event aimed at offering behavior health and wellness resources to adults and youth at every stage of life. Featured activities include farmers market, free food demonstrations and samples, love a good sample, live fitness demos, free health screenings, entertainment, and educational experiences. And last but not least, join the Alzheimer's Association in Parks and Recreation on Saturday, May 23rd from 1 p.m. to 3 p.m. for Brain Health event focusing on how to reduce risk and build resilience at every age. This family-friendly event offered virtually and in person will bring together experts and neighbors to discuss practical tips for reducing risk and building resilience and share experiences and ideas to support families and individuals affected by Alzheimer's in our community. Register for the event today. Link is on the slide. Back to you, Shanae.
Thank you, AJ. So as you can see, everyone, there's so much going on in the community, and that's just a snapshot. So again, if you all have any events going on, any services that you all want us to help promote, we're happy to do so. Feel free to just send an email to me directly or to the PGHAC email address, and we can get those shared out for you. And if you have not done so already, go ahead and scan the QR code, or you can click the link in the follow-up email to provide your updated contact information for the coalition directory. We have some new faces with us, and we just want to make sure that we are maintaining an accurate record of our coalition members. We also want to make sure that we give credit to those who are assisting us in this CHIP development process. We want to highlight your names and your organizations in that CHIP document. So please, please, please fill out this survey so we can make sure we give credit where credit is due. Are there any other partner announcements at this time? Hearing none, just a quick snapshot of our upcoming work group meetings for the remaining quarter. We encourage everyone to participate in any of the other work groups, especially during this CHIP planning phase, because you all are the experts. And so we're leaning on you for your voice and your vision and your expertise. But our next Healthy Start work group meeting will be Thursday, May 21st, same time, same place. And as we close, again, I just have to express my gratitude to you all. Your insight and your partnership are truly invaluable, and we appreciate you taking the time to be here with us today. And we look forward to continuing this work together. Have a wonderful afternoon. Enjoy this heat, enjoy the sunshine, and we'll be in touch soon. Have a great one, everyone. Thank you. AJ, you good?
Yep, I have to stay to make sure everybody leaves so I can do the recording.
Okay.